According to the Centers for Disease Control and Prevention, overdoses have reached epidemic levels. Anyone who takes prescription opioids such as oxycodone, morphine, and codeine, or illegal opioids such as heroin, and members of their household are potentially at risk of experiencing an accidental, life-threatening opioid overdose. But what happens during an opioid overdose? Due to their effect on the part of the brain which regulates breathing, opioids in high doses can cause people to experience signs of breathing problems and severe sleepiness or not being able to respond, potentially leading to death. Narcan nasal spray is the first nasal formulation of naloxone to be FDA approved as a prescription medicine for the emergency treatment of a known or suspected opioid overdose. Narcan nasal spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan nasal spray is safe and effective in children for known or suspected opioid overdose. Please pay particular attention to the important safety information during the course of and at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray was designed for ease of use in emergency overdose situations outside of a healthcare setting and is used by first responders. Since most opioid overdose emergencies occur at home and in front of loved ones, Narcan nasal spray was developed for use without specialized medical training by family, friends, caregivers, and others. Remember to always administer in accordance with the instructions for use. Use Narcan nasal spray right away if you or your caregiver think signs or symptoms of an opioid overdose are present, even if you're not sure, because an opioid overdose can cause severe injury or death. Signs and symptoms of an opioid overdose may include unusual sleepiness, and you are not able to awaken the person with a loud voice or by rubbing firmly on the middle of their chest. Breathing problems, including slow or shallow breathing in someone difficult to awaken or who looks like they are not breathing. The black circle in the center of the colored part of the eye is very small, sometimes called pinpoint pupils, in someone difficult to awaken. Family members, caregivers, or other people who may have to use Narcan nasal spray in an opioid overdose should know where Narcan nasal spray is stored and how to give Narcan nasal spray before an opioid overdose happens. When Narcan nasal spray is administered to a patient experiencing an opioid emergency, naloxone molecules travel through the body to the brain. The naloxone molecules attach to the same receptor sites with a greater affinity than most opioid molecules. By displacing the opioid molecules, naloxone can reverse the potentially life-threatening effects of the overdose, specifically respiratory depression. Get emergency medical help right away after giving the first dose of Narcan nasal spray. Rescue breathing or CPR, cardiopulmonary resuscitation, may be given while waiting for emergency medical help. The signs and symptoms of an opioid overdose can return after Narcan nasal spray is given. If this happens, give another dose after 2 to 3 minutes using a new Narcan nasal spray device and watch the person closely until emergency help is received. Narcan nasal spray 4 mg delivers a consistent, concentrated 4 mg dose of naloxone to temporarily reverse the effects of an overdose of opioid medicines. The medicine in Narcan nasal spray has no effect in people who are not taking opioid medicines. Always carry Narcan nasal spray with you in case of an opioid overdose. Narcan nasal spray is available at the pharmacy counter. Talk to your doctor or pharmacist today. Please continue to watch this video for additional important safety information. Additional important safety information. Who should not use Narcan nasal spray? Do not use Narcan nasal spray if you are allergic to naloxone hydrochloride or any of the ingredients in Narcan nasal spray. What should I tell my healthcare provider before using Narcan nasal spray? Before using Narcan nasal spray, tell your healthcare provider about all of your medical conditions, including if you have heart problems, are pregnant or plan to become pregnant. Use of Narcan nasal spray may cause withdrawal symptoms in your unborn baby. Your unborn baby should be examined by a healthcare provider right away after you use Narcan nasal spray. Are breastfeeding or plan to breastfeed. It is not known if Narcan nasal spray passes into your breast milk. Tell your healthcare provider about the medicines you take, including prescription and over-the-counter medicines, drugs, vitamins, and herbal supplements. What are the possible side effects of Narcan nasal spray? Sudden opioid withdrawal symptoms, which can be severe. In someone who has been using opioids regularly, opioid withdrawal symptoms can happen suddenly after receiving Narcan nasal spray and may include body aches, diarrhea, increased heart rate, fever, runny nose, sneezing, goosebumps, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, stomach cramping, weakness, increased blood pressure. Some patients may show aggressive behavior upon abrupt reversal of an opioid overdose. In infants under 4 weeks old who've been receiving opioids regularly, sudden opioid withdrawal may be life-threatening if not treated the right way. Signs and symptoms include seizures, crying more than usual, and increased reflexes. These are not all of the possible side effects of Narcan nasal spray. Call your doctor for medical advice about side effects. The risk information provided here is not comprehensive. To learn more, talk about Narcan nasal spray with your healthcare provider or pharmacist. The FDA-approved product labeling can be found at www.narcan.com/static/gen2-prescribing-information.pdf. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including patient information for Narcan nasal spray.